because ironically, as I moved over to get my MPH a little bit after graduating, I had already done most of the things in their program. So it really felt good to know that I had a solid foundation, and attending Georgia Southern definitely shapes the way that I tend to practice on a daily basis. So I named my presentation Blooming Health Equity While Neglecting the Roots, because health equity tends to be a hot topic. It's something that everyone talks about. And it's, oh, we have to look at equity. We have to think about what everyone needs and all of these pieces. But a lot of people really don't take into consideration what equity, the impacts of equity, and any potential negative side effects. And so that's why I say we often neglect the roots. And what I want to do is kind of take everyone on a journey of knowing public health theory or learning in this space and going beyond that. So a little bit about me, as Dr. Telfer already mentioned, I graduated from Georgia Southern with my Bachelor of Public Health in 2015. And at the time, everyone was pushing Dr. Chopak and Dr. Walker, and everyone was like, you have to get your CHES if you're doing health education. And, you know, we're making this a standard. And even if it isn't now, we'll be the first and we'll make it that. And so I went on to do what I was taught to do, and I got my CHES, which is a Certified Health Education Specialist exam that you can sit for. And then I went to Georgia State, the other GSU, and got my Master of Public Health in Health Behavior and Promotion. And so as I mentioned before, I've really received a phenomenal foundation at Georgia Southern. And so after leaving Georgia Southern, I started interning at Morehouse School of Medicine under Dr. David Satcher's Satcher Health Leadership Institute. And at the time, they were doing some work around healthy parenting for parents and caregivers of children ages 0 to 5. And during that time, I connected with some grandparents who coincidentally named me the urban advocate. So the advocacy part was just, there was some unequitable things happening. And me as an unpaid intern was just like, I'm put on the table because I'm not losing anything here. And I'm willing to lose it all if it means that you all get what you need. And then one particular grandparent, they added in the word urban because there were people who were not Black, and they were just like, you know, instead of saying the word Black, which sometimes still seems to be an uncomfortable word for a lot of people to just kind of say, they were using the word urban, which urban does not mean Black. It's how you define a geographical area. And so over time, it went from me kind of leveraging the few things that I had learned in undergrad, because at this point, I didn't have a huge amount of real-time experience, but I knew some theories and some things, to me just kind of bouncing around South and West Atlanta. And so it got to a point where it was like, I wanted to do things. I didn't want to go the nonprofit route. And so what I did was I created a social enterprise. And so Alexis Community Group is my consulting company, where I serve as founder and principal to basically offer the services that I would do for free for the urban advocate communities that we service at a rate for others. And I help corporations assess their social impact. And then I take that same funding that they're paying us to do these services, and I directly invest it through the urban advocate in our target communities. In this method, sometimes it is a little rocky, right? Because if I'm not working, we don't bring in any money, but it has allowed us to have a level of flexibility that I don't think we would ever have had before now. So I like to keep kind of centered the fact that I practice with the idea that when I enter a space, I'm here so we can unlearn and re-experience. And I think that's really important, because a lot of the times when we come into a space, right, we constantly are disarming people from the traumas that we've experienced, but rarely are we willing to admit that we're wrong or that we've learned something new and now we need to operate in another capacity. So I'm here to unlearn some things, learn some new things, and then hopefully the next time I enter a space, or as I move forward through our life and I'm experiencing things, I can re-experience something in a different way. A few things about me: I speak up, I share my ideas, I think deeply and critically, which is what I get paid for. I believe in Black liberation. I reserve the right to change my thoughts as I learn, and I hold space for those who want to participate in the space I'm in. And so I think it's always important to kind of restate to yourself, who are you, what do you stand for, and what do you want people to be cognizant of when you operate in spaces. So a few kind of like of my big three, and really I would say four, because I want to throw another term out there: positive childhood experiences, which has been kind of like a term shift from adverse childhood experiences. Sometimes you may see it as positive adverse childhood experiences, but when we say positive childhood experiences, right, we want to just set a standard from the beginning. And so I really kind of focus on that term a lot, with the centering fact that a large part of the rest of our life is dictated by what happens when we're of ages 0 to 5 years old. And I don't think enough people kind of center around that age and really pay close enough attention to it. Trauma informed, because as I mentioned earlier, when we walk into a space, the first thing we're greeted by is people's traumas. So how their mannerisms, how they interact with you, a lot of it tends to be a response of all of their collective experiences, both good trauma, resilient trauma, all of these pieces. And as someone like me who moves through a lot of these spaces, I have to be cognizant of that. And then trauma response, because that's where a lot of my work is centered under. And I hate that I have to center my work in trauma response, because it's like you're cleaning up on the back end, right? Whereas you really would like it to be in prevention and other areas that prevent us from having to respond to something negative. So I wanted to kind of start off with the idea of the pair of aces, because a lot of the times when you hear people speak in theory, in an ideal world is what these theories tend to be set under, right? So theories, they've been replicated over and over again, and you have a good enough amount of evidence to say that this is having a progressive or a positive shifting impact. When you look at the pair of aces, you have adverse childhood experiences, which are things that are happening around you, things that we can see, things that if you go to a doctor or someone like that, they can identify, like, oh, your mom is going through a divorce, or oh, ma'am, you're experiencing this. Let's see what we can do to help you. But then you have these community environments underneath, where we're looking at poverty, discrimination, community disruption, violence, which is where my work kind of hangs out under. But all of these pieces are important. And so that's why we have to remember that. And the way that I practice is public health. Anything that impacts the public can be public health. And I think we try to put and fit things into little pieces a lot, when it's certainly worth more than that. So there's that. And then the fact that we don't really take the public health approach, which would be looking at social determinants of health and all of these other pieces, but everything has to work congruently all at the same time in order for us to really have some sort of attachment and positive movement on what we're trying to impact. So as you can kind of see in the piece that I added here, the soil in which some children's lives are rooted. And so that, me using the analogy of like water and soil and rooting and blooming, like we talk about the things that we plant and how what you plant, if you nurture it, it will grow. If you don't nurture it, it may grow, but it won't grow in the way that it should grow if we cared for it more. And really, I could amplify that analogy with the work from Dr. Kamara Jones, what she does with her gardener's tale, and that takes into account, racism and all of these other layers. And I encourage you, if you are interested in kind of looking at those pieces, to check out her work, because again, it's more than just what meets the eye that we have to consider in order to attack things. And I would even say that when we're looking at our community environments, we're looking at the structural determinants and how the structure of the things that we exist in impact our day-to-day. So a large part of my work is set under community-based participatory research, and I realized I didn't firmly write that out anywhere. So again, CBPR is community-based participatory research. And I will say this is a term that I learned while studying at Georgia Southern, when I experienced, or I learned about methods like photo voice from, I want to say it was a class I took with Dr. Walker, and talking about just the different layers of public health. I don't really think there was any kind of foundational class that didn't speak to centering community. And so what I challenge everyone to do, and what I do in my work, is think about what is equity really, and how do we define it in a research context. So a lot of times you may see the graphic where it's like, you know, equality is making sure that everyone has the same thing. So if I have a house, everyone else on this phone call also has a house, right? But then you'll see on the second side of the graphic, it'll say, well, equity would be, we're asking people what they would like to live in or where they would like to live, and then allowing them to decide what style of housing they want, how many rooms do they actually need, and those types of things. And I bring up that example because someone sent me something earlier today, and I was looking at it like, okay, that's one way of having this conversation. But I like the term community-based participatory research, and you may see similar versions of this elsewhere because it levels the playing field, right? Everyone is an expert and everyone brings value. So from your participants, if you're running a program, from those that you are hoping to impact, if you're just focusing on a target community and rolling out things, we have to value every person and every experience as an expert because they've lived it. And now you're wanting them to relearn or unlearn or re-experience something. And so they're the expert. We have to remember that value and take that into consideration as we try to introduce something new and special. I also think about knowledge and action is what's needed to create social change. So at some point you have to have some base level of knowledge, and that's typically something that I would provide, right? So I use my brain a lot to think, to push, to do, and very critically figure out the best way to create social change. And so that's why I say this is where we're moving beyond theory. So theory is always great. It's a great foundation. It's great to know what has and hasn't worked. But similar to how being a millennial, we went from an AOL disk to internet right here at our fingertips. We are now talking about real world social change that we have to take into consideration, and providing action behind it. I think follow-up is one of the toughest things in the world for people to sometimes do. And it can easily get very repetitive. You're following up to follow up to follow up. You're having a conversation to plan to have the next conversation. So just being really intentional about what you want to experience in this world and what you want to put out. So when we talk about looking at our communities as a whole, we're talking about recognizing community as a unit of identity. So I always cringe when I hear people say, well, the community doesn't want this, or the community doesn't want that. Well, if you can't see yourself as a part of this community that you are serving, maybe we should take some steps back, realize that you have to figure out what your identity is in this space, and realize that if you are operating and working on community issues, then you are a part of this community, whether you live there or not. And so it's our community, my community, communities that I operate within, I live within. And so it's an identity, and it's shared the same way that we share experiences, building on collective strengths and shared resources. So I'm a huge fan of moving beyond just not reinventing the wheel, but identifying what's already here and what can we strengthen. So I think that's one of the hugest pieces of working in community-based public health, is that a lot of the times we come into a space, we have great ideas, and then we're trying to roll them out instead of saying, okay, well, what's here? And I don't just mean a needs assessment. I mean, if you know of a small organization that is providing childcare, and you know that there are people all across this community who need childcare in order to attend your sessions. How can you employ that specific organization who has a connection with your same community to come in and facilitate the childcare, right? And then how do we make sure that the childcare that these people are experiencing, the children are experiencing while you're in your sessions, is aligned with the sessions? Like, we have to be intentional about everything that we do, because we need to move past just having a one-shot experience. It's about strength, collectivism, relationships, facilitating partnership, and capacity building throughout the process. I think this is one that is kind of always left to the end. It's like, you want to capacity build on the back end, or we spend so much time capacity building that you're at the end of a grant fund and now you're trying to hurry up and implement something. It's a fine line, and it's hard to know when you're there and when you need more, but cultural competency and things like that play a huge role in knowing how you can establish relationships. Disseminating pertinent information, data, and other findings to all participants. I do think the whole readability piece is sometimes lost. So we do things and we send out little pieces and we send out final reports, but when do you ever make it so that those who participated, those who shared their homes and their spaces with you, understand what you found, and maybe even empower them to utilize this same data to help you push something forward, right? So a lot of that is something that I really focus on, and I'm very sensitive about how we're sharing anything that we're collecting, anything that I'm collecting, for anyone involved. Involving a long-term process and commitment. I'm huge on making commitments. You'll know that I've been working on gun-related violence in Atlanta's neighborhood planning and EV communities, with the emphasis on Mechanicsville for the last few years, but we've been doing this work and building capacity around it. I would say our capacity building stages lasted from 2017 up until maybe 2020. And then that capacity building led to the establishment of things like Cure Violence Here. We have a trauma response network, which is a network of all of those who recognize our community as a unit of identity and want to collectively strengthen our community and share resources. I think that's the best way to put it. And then we're moving forward, right? So some of us have had to zoom in on certain pieces, hot spots, and things like that. I work with them, in my opinion, what is either the first or the second hottest beat in the city of Atlanta to work, which would be like the Windsor Street, Richardson, Mechanicsville area. And then seeking balance between research and action, right? So I always think that if you're surveying people or if you're having interviews, right, you should be providing some action. Of course, you want to pay for people's time because they are the expert here, but also what can you do to help amplify the efforts that are going on around? What can you do to help put something on the map, right? Sometimes it's not all about having money to pour into something, but your time, your effort, your skill set, that who knows, you designing one pamphlet for a collective of people that are organizing can help catapult their advocacy into an actual legislation, an ordinance, a resolution, or something of that extent that they need to help them get to the next level. So I encourage everyone to challenge assumptions and norms. And so when I say norms, I mean whatever our community may be used to seeing, may be used to understanding, let's challenge it all. I'm a huge believer in dreaming astronomically big. And even if the thing that comes true is the big dream and not the astronomical dream, you're still somewhere that's different. You're still somewhere that's new. And because we've decided to dream and challenge assumptions, we're in a new space to re-experience. So traditionally, when we're looking at getting buy-in for our program, it looks like engaging gatekeepers and allowing them to lead researchers to more connections. I challenge you to go further. I challenge you to find who's here. I challenge you to canvas, as we're doing here. We have a double-sided door hanger in Councilmember Dozier's hand here. He's in the Army shirt, and he's out with my team helping us to canvas about gun-related violence experiences. And you see, we have people of all ages. Everyone is out here, and we're just like, let's see how we can go further. Let's not get the one shot approaches only, right? And so there's always a whole community of people. I say if you go to community meetings, things like that, that's typically the tip of the iceberg people, the low-hanging fruit. What about the people who never leave their houses? What about the people who only leave their house to go to work and come home? What can we do to reach those people? And you will find that you can have the same people living on one row of houses, one block, and they all have completely different experiences. But if you only go to the place where you're guaranteed to meet someone, you're only going to get that one experience. And so just to kind of share some little pieces of my work and what we've been doing, our Guns Down Mechanicsville project has been one of the biggest project we've done to date. It is funded by a Stadium Neighborhoods Community Trust Fund grant. Well, it was funded, it was seeded by, rather, is what I would like to say. We applied for a $25,000 grant, which is money that our neighborhoods around the old Turner Field received from the sale of Turner Field. So when the Braves moved to Cobb County, they sold land, and our community was given, or had to fight for, was originally promised through a community benefits agreement. They basically reneged on it, and then we had to fight and advocate for a small portion of an overall larger portion that we were was supposed to be given. So to make investments in our community, let me say it like that. And so here's some things you were doing, and this all happened during the pandemic. So the first year we kind of shut everything down, and we were doing smaller things like healing circles on virtually on Zoom, and just different types of community care things, trying to get out PPE, stuff like that. And then the second year, like I mentioned earlier, right? So you see this Guns Down Mechanicsville flyer. We had everyone come out to a wide open space that was in the center point of our community. And just as we were asking for things such as taking our survey and learning about cure violence, we were encouraging people to learn it, come and take our mini photography class, which was supposed to lead to a walking tour of Mechanicsville to focus on taking photos of areas that have experienced gun-related violence. And as you can see down here, it's like 1, take the survey, 2, add to the story map, 3, sign up for an interview. And then up top here in the middle, what looks like a postcard is a prime example of the way that we like to disseminate data. So taking our survey and tell us your experiences with gun-related violence. This is the backside of a flyer that I made, a postcard shaped, and we canvas and put these postcards out. So it's almost as if you were getting mail. And again, everything you see here is hand designed by me to be pushed out. So everything we do is very organic, it's very small, not always well-funded, but well-intentioned and targeted as much as we could get it. And so we're doing things around reclaiming space, which goes similar under like trauma response. And one of the hugest things I want to kind of highlight is Pulse, which you see here in the center. It's our mindful microcast centering healing and fighting gun-related trauma. So through all of the work that we've been doing, we realized that we need to find a way to connect stories to people. And so a microcast is similar to a podcast, but it's 10 minutes or less. And what we're asking about is, how have you healed from experiencing a gun-related incident? And then how have you tried to fight back if you have? And we have like a set of interview questions, etc. But just to kind of keep it very surface level, that's what we're talking about. I will say in our same communities that we're working in, we've had 2 teens killed in this last year. We've had shootings, sometimes 7 days straight. Sometimes it's a little space in between. And I will say that as it heats up outside, so does activity. And so we're excited to ramp up things. We're excited to connect more people. We're excited to hold and reclaim space and create more safe zones and do what we can in order to figure out how to combat behaviors. And that's a large part of what anything in public health is, right? People already have set behaviors, and what you want them to do is establish a new norm. You want them to change a behavior for something that is healthier, more positive, will have a better impact on them and those around them. And so there's always, the saying that it takes 21 days to form a new habit. I think in public health, it definitely takes way longer. And so you have to also keep in mind that we can take 10 steps forward. And even if you just take 1 or 2 or even 5 steps back, you're still 5 steps, 4 steps, 8 steps closer to where you want to be than you were previously when you were 10 steps back. So how do I know when community is progressing? I'm a huge fan of, if you ever heard of PACES Connection, which was formerly ACES Connection. I've been connected with them for years and watching the work of Carrie Shipp and everyone over there. And this graphic that they sent out, I believe earlier this year, just kind of really captured some of the things that I think about when someone says, well, how do you know that all of the things that you were doing in your communities is working? How do you know when something is changed, something is different? Things like this, right? When you see people making a better choice than you know they would have made 2 or 3 years ago, 6 months ago, when you see more green spaces, when you see structural changes such as, and not even necessarily along, when I say structural, I don't necessarily mean gentrification, but when you see people taking care of their homes, when you see people outside, when you see people having softer, kinder conversations with each other, those types of things, areas stay cleaner for longer. And just, really showing a level of community care and connection. So these are things that I look for when we talk about having a progressed, healed, beneficial community. And it's an ongoing thing, right? So it's not like we have a rubric and once we get there, everything is fine. No, you can keep at it every single day. I'm perfectly fine and content in knowing that if all I do for the rest of my career is work in these neighborhoods, specifically with gun-related violence, then I'm committed to doing that, because I know that just as we've experienced violence as Black people, as low-income communities for decades, centuries, that is going to take similar amounts of time in order for us to move forward. And so I just love this graphic again because it really talks about feeling safe, valued, and loved. And I think those are things that we have to have centered in our community in order to see something bigger. So just to kind of wrap everything up, here's how you can connect with me. I'm on LinkedIn, Twitter, Instagram. You can send me an email. You can also follow our work from the Urban Advocate. We're on Twitter, Instagram, Facebook. We have a website, but a lot of what we do is on the ground. So we don't really put a lot of our physical stuff out there, but we definitely push things so that people know what we're doing. And that's kind of what we've been up to lately. So I just kind of say thank you all for having me. I am very excited to be here. And I will say this has been on my bucket list to graduate and then share all the cool things that I do. So I'm excited to be here.
Well, thank you, Ms. Lester, and we appreciate that presentation. So, I have some questions, but we will open up the mic now to our audience to see if y'all have questions for Ms. Lester. Anybody, please. Questions or comments?
Great presentation. I enjoyed it.
Thank you.
Okay, well, I'll start the conversation. So Ms. Lester, can you talk a little bit about what are some of the more vexing challenges that your group have had, doing the work that you do, given that you're on the ground and that's you've not really chosen sort of the easy path of community work. So could you talk a little bit about some of the more vexing challenges, first of all, and then second of all, how have you dealt with those challenges, either successfully or unsuccessfully? 2 to 3 would, be fine.
I think the largest challenge is your belief in yourself to be able to do something, your self-efficacy, your self-confidence, all of those type of self things, because to lead something like this, it definitely messes with you. You do enough trauma response, you're in enough spaces and you see enough kind of scenes, and you get to a point where you're like, this is a lot on a daily basis. And so one of the biggest things that I would say on a positive side is knowing how to care for yourself is a huge thing. And I know self-care has become like a hot topic these days, but really like investing and centering yourself. I can't be my best self for my community if I'm not being my best self in this moment. So knowing when to step away, also communicating with everyone. So knowing if you walk into a meeting and you explode or have a bad day, just say, you guys, you know, I'm having a bad day. I remember last week when I had to go and see so-and-so after that incident with the gun, and it just has been bothering me. I also attend therapy. So that's one of the hugest things I'd say. The second thing I would say is that listen to those around you. So if you are working in a community and they're telling you that, you know, I don't like this, or this doesn't feel like me, or I don't believe in that, right? Either you have two options. You listen and you try to help to find something that maybe is a better fit, or you have to encourage them to try it anyway. Well, what we're doing isn't working. Let's try something new. If you don't like this, then let's see what you did like about it, and then let's take that and add something else. So I always tell people, like, there's always a block to build on no matter what you do. If everything seems bad, there's always that one thing that it wasn't horrible, it was okay. And take that and then try again. And so that's the last thing I would say is if first you don't succeed, you have to get back up and try again.
Well, can you give us like a case example of this?
Mm-hmm. Sure. Let's see. Something that I experienced more recently would be the shift of, I think a lot of people are scared to like work themselves out of a job or work themselves out of a space. But we did all of this capacity building from 2017 to 2020, 2021 to get our violence prevention kind of established. And when Cure Violence came to Atlanta, when the Trauma Response Network was really up and rolling, these were typically things that we would do. So it was myself and Chris 180, which is a huge mental health organization in Atlanta. People typically know them for like their mental health and adoption-based services, but they have a government advice prevention portion. And it was their director, Alfred Garner, and myself. And so establishing these new programs took away roles from what we were doing. And no one considered the fact that the Urban Advocate hadn't been funded by anything. You're taking all of the tasks that we would normally do away, and we're trying to keep everyone together and keep conversations flowing, but all of our pieces fell apart. And so when everything fell apart and we were kind of left on the end, it was either A, we start duplicating and digging deeper into what's going on, or B, let's figure out where the gaps are in this work that we're doing and let's dig deeper there. And so what came out of that gap was Guns Down Mechanicsville. That was my response to basically being worked out of the roles that we previously had.
Thank you. That's a good example. We appreciate that. So I know that you have worked to apply the public health work that you have. Can you talk a little bit about how you are able to manage the work that you're doing in the community, just doing the COVID restrictions? You know, that still, I mean, I shouldn't say just during, I should say while we're still in COVID restrictions, because we have different varieties, and you're in the middle of like Atlanta, which is a very large, you know, urban area, but also has some not so great, you know, infection statistics. So can you speak a little bit about that?
Definitely. I shut everything down. So when we went into COVID, I shut everything down from, what was it, like March 2020 to basically March 2021. There were very few times that I went outside or I convened my consultants or our team or anyone to do anything. So, but I figured out where our talents best lied, which was keeping things rolling on a community front. So whether it's calling people, having conversations, being able to say, hey, someone needs to go, of the outreach team that was doing outreach, hey, someone needs to go stop by this person's house or this senior's house, or this lady has all 10 of her kids at home for the foreseeable future, someone maybe should go by and try to drop some outdoor equipment off or something like that. And so that's typically where we kind of lied for most of the things. Outside of that, when we finally started kind of getting back together, I actually had, in that point in time, I had gotten sick, but not from COVID, from other things. And so last year, I maybe only did 3 or 4 things, but turns out, according to everyone else around me, the 3 or 4 things I did do in relation to organizing around Guns Down Mechanicsville, we do a huge Halloween festival, even with doing these things outside, even with every COVID protocol restriction, turning people away, everything, our attendance was like double that we've ever had or anything. So what I do is just, I'm very firm. It's not hard for me to say no. And so if people are walking up and they don't have on PPE, if they're not willing to wash their hands, know that there's no eating in here, then we've had to kind of just say, well, this is not a good space for you. Let's try something at another time and turn people away. And so people understand very quickly that when I say you have to really care for and think about those around you, not just yourself, that's what we have to do. So really just kind of being firm in COVID protocol and thinking twice about the risk that something could have and getting tested. I've been tested for COVID over 163 times. So I just, try to do the best that I can. Even now, I'm in City Hall now, but I have my mask right here and I'm the only person in this space. But when I walk out of here, mask goes back on. So just even when other people aren't doing it, I've decided I'm wearing a mask and that's the best that I can do.
Okay, thank you. So my last comment is for most of the people on or our students. What wisdom would you share with them in terms of like how you've sort of maximize the use of your training? Not that I want to blow all our horns on that end, but how has that helped you in your career, and what words of wisdom would you give to your colleagues here?
I would say, like, don't underestimate your experience at Georgia Southern. I think one of the coolest things about my experience was program planning 1 and 2, and then evaluation, and also taking biostatistics with Dr. Bland. And even though I got a C in biostatistics in my master's program, when I retook it and I found my notes about Bland's rules of order, I got a 96. So what I will say is that there's never been a time where I've reached back to ask questions or need anything from any of the professors I've had, and they were not responsive in talking to me. And even now, this opportunity, Dr. Chopak saw me at Sophie last year because we presented at Sophie. And she was like, hey, send me an email. I want you to do a presentation. And I'm just like, hey, there are very few people who can call me and say, please come. But Dr. Chopak, Dr. Bland, Dr. Walker, Dr. Lawrence, like, they made investments into my just learning and understanding and being willing to answer questions, because I ask all the questions and I challenge a lot of things, and they never were like, okay, well, you're doing a lot, or I don't have a response for that. It was just like, I'm not sure, you look into it, I'll look into it, and then we can figure it out together. And so if you take advantage of the opportunities that the School of Public Health offers, then you will be set up to try and do anything in the world. You don't have to work at the CDC. You don't have to work in traditional Department of Public Health. You don't have to be, you don't have to be a person who goes to just the traditional public health roles that we learn about. Literally anything that impacts the public, in my opinion, is a public health issue. And you can take the lens that you have learned and apply it to anything to help make something better.
Okay. Well, thank you very much on that end. So before we close our session, do anybody who is online have a comment or a question for Ms. Luster? Okay, well, Ms. Luster, most of the people that left have left you in the chat. They appreciate what you have presented and consider it a great job. So we will follow up. So just as a note to everyone, we want to just thank Ms. Luster for your presentation. We truly appreciate it. We have recorded it, so this recording will be posted on our site along with the slides that we'll get from Ms. Luster as well, and her contact information is prominently featured, so we'll be following up with her. Okay, well, thanks everyone for your time and coming to our first session. We remind you that we have a session coming up very soon. Please check our list. You'll get notices from Ms. Harvey on this matter, and thank you very much for Ms. Luster and also your community colleagues who I have seen on the Zoom as well today. All right, thank you for your time, and we look forward to the follow-up.
Thank you.
Okay, bye.
Bye.